Hello, everyone. Welcome to our day 6 of our 12 Days of Wellness series. Today, we are talking about how to get better sleep during the holidays, which, as we know, the time is changing. It's colder. We're stressed, a little more anxious, so our sleep might be affected. So, our guest for today and our host is Dr. Chris Hammond. He will be sharing some tips and information with us. So, I'll let him introduce himself and what he does.
Hello, Chris Hammond. I'm a sleep specialist out of the Ogden Clinic. I've been in practice for 15 years, and so I'm hopeful to entertain and answer any questions to talk about good sleep. Good sleep hygiene probably falls under good stress management this time of the year. So, but we'll go into it. So, questions that you have, but I think common practices with good sleep, common sense in many regards in terms of good sleep hygiene, of course, what we'll go into. And of course, identifying any primary sleep problems that can lead to poor sleep or even insomnia. But yeah, let's go to it.
Yeah, awesome. So, like I mentioned at the beginning, during the holidays, it's a lot more stressful. We're a lot more anxious, kind of running around, getting gifts, all of that. So, our stress and our anxiety might be a little heightened. How does that come into play with our sleep, and how can our sleep be affected during this time?
Well, busyness and stress, of course, and then we fall into bad habits. Bad habits such as, well, worrying about things, we take those to bed, of course. And so our busy mind may keep us distracted in a lot of ways, and especially keeping us from sleeping well. So that is a significant problem. Certainly, the holidays do bring some level of stress. And so taking that to bed is not a good idea. So what we want to do is make a draft of things before we get to bed. And then that relates to everything, not just the stress of the holidays and what presents we have to buy and parties to plan, but also identifying those stressors on paper is the important thing. And we want to put that on paper, write it out. We don't want to take it to bed. Bed should
Mhm.
be just clear. We go to bed to sleep. And so don't ruminate, certainly. And so we can do all that on paper. So do that an hour before bed. Write out what you have to do, what you did that day, maybe problems you encountered. Just a good, what we call a sleep diary, day-to-day journaling. And so write out those problems and concerns. Then, when you go to bed, you don't take them with you, and so you don't have those distractions and things you have to plan on for tomorrow and all those concerns.
Right.
I think it's important to remedy a lot of that an hour before bed. Take it to a journal, write it out, write out the problems, write out what you're going to do the next day, so you put that mentally away for
Mhm.
the next day, so you don't have to worry about it in bed.
Right. Yeah, that's a really good point. I think a lot of us don't really stop and think about how much our day-to-day activities kind of affect our sleep and when we go to bed, and either we can't sleep and we wake up and we're like, why couldn't I get a good, night's
Mhm.
sleep? So that's a good practice and a good tip for people to kind of take and start kind of journaling beforehand at nighttime.
Yeah, it's something we were probably taught as kids, especially in our culture, and a lot of us have gotten away with that. But it can be actually very, very therapeutic. And then other things you just want to avoid in bed. Of course, it's easy to jump on Amazon on our phones, right,
Right.
and say, "Oh, I got to shop for this person, buy this,
Hmm.
or oh, this looks appealing."
Right.
Obvious distraction. Now you have that along, that just the mental content of our mental shopping list, but also just the light. The light, even though we have our blue light settings on our
Hmm.
phone, which can be helpful, but still maybe impeding somewhat on circadian rhythm, which is an internal biological clock that tells us when to sleep, when to wake. And so, if we have enough light exposure, because we're probably already doing all sorts of things,
Right.
taking care of the Christmas tree, exposed to all these lights in brightly lit rooms at night. And so, that hour or two exposure, bright lights can somewhat impede our circadian rhythms, as telling us when we should be getting ready to sleep.
Right.
And even our tablets and computers and phones and so forth is going to have that light sufficiently that may keep us from not just getting to sleep at an adequate time, but maybe keep us in light sleep throughout the night. So that kind of exposure too, I think, is important to keep in mind as we're preparing ourselves mentally to get to sleep.
Right. And those are both good practices because, like you said, it's very common for us to get on our phones, kind of bring on those stressors a little more to bed when we are still looking for gifts or looking for things. So, those two things together definitely would help with bettering our sleep and kind of getting back into that rhythm, right?
I think if you can take away those two things, the content, the busyness, and then of course anything electronic shouldn't be allowed in the room.
Right.
But, is that practical? A lot of us use our phones for alarm clocks, and if we get a notification, we're tempted to grab it, look
Right.
things
It's
up.
hard. Yeah, it's
Mhm.
hard for a lot of people, but I think just keeping in mind, okay, if I put my phone away, it might help me a little bit more throughout the night. So when our sleep is affected and when we're not able to sleep, like some people struggle with this for a very long time and might not seek, medical health or medical help or professional help. How does that affect our health in the long term? Like if we don't start like building healthy practices before bed.
Okay. Well, this is a very good question that's under a lot of research right now. We've seen lots of reports on sleep deprivation and what it does to our health. And so I use, some of that data with reserve because it doesn't apply to everybody. Where studies show that people that have sleep deprivation, perhaps 6 hours or less consistently, most nights of the week, month, so forth, and even for years, that has been implicated, potentially leading to, well, cancers, cardiovascular disease, maybe dementia.
Right.
And so we see that as a health detriment, right? Sleep deprivation in general. So, of course, all of us, well, 50% of the population experiences insomnia sometime or the other, and that's normal. And how we define insomnia can be so ambiguous. Seeing your clinician, they may define the insomnia a little bit more if it's a chronic issue that's ongoing. But periods of poor sleep or sleep deprivation from night to night, really normal and kind of reacted to our current stressors. And so we all can experience that, and that can be considered expected or normal. When it gets to be chronic, it's a regular process of problems where we're just not sleeping well, generally less than 6 hours night to night. That tends to add up. That sleep debt adds up, and we know it can be associated with a variety of metabolic and vascular conditions, in addition to brain performance. And so, of course, well, plenty of studies showing people that are sleep deprived, just even one night, but several studies showing 3 night studies for example, patients that don't sleep more than 4 hours for those 3 nights. Their function, their vigilance is equivalent to someone that's actually legally intoxicated.
Mhm.
And so that can give us an idea of acute measures, how we respond to our environment when we are sleep deprived. But you can imagine someone with that going on for months and years, what that would do to the brain. And so the health implications are pretty impressive. We can talk about metabolic consequences, glucose intolerance issues, in addition to neurological problems, of course, the heart. And of course, cancers is pretty well established too, and what that does to the stress to our system. And I think that's the evidence that we're seeing nowadays is what sleep deprivation does on inflammatory systems of our
Mhm.
body. And we know what inflammation does. It can lead to these chronic illnesses, chronic pain, and of course, the chronic fatigue that's often tied to this.
Right. And that's a really good thing you bring up because a lot of people don't associate, health issues to their sleep. They might be experiencing something new and they might try to find other reasons why it's happening, but it can really be tied to your sleep health, how you're sleeping, and all these other factors, right?
And I think the old mentality of sleep was like, well, just push through it,
Right.
push through your day. Probably uh, early morning. The early bird gets the worm. That kind of attitude, that mentality, kind of very traditional,
Mhm.
where we seem to be better off if we sleep less and we get more done, be more productive. Well, that's going away. We spend, and we should spend, a third of our time in the 24-hour period as sleep. And it's important that that one-third period of our sleep is good quality.
Right.
And so that, yes, that includes practices to impede that quality of sleep. That's also looking at other primary sleep disorders that may impede quality sleep, such as sleep apnea, such as leg issues or nocturnal movement disorders.
Mhm.
Another thing that's going on at night that keep us very light sleep. So we want to mitigate all those issues, get those looked at, get those addressed if we need to, because our quality sleep plays a role in how we do the next 2/3 of our day,
Right.
but not just the immediate effects, but also long-term effects. So with the aging brain, we need to protect our brain as best as we can. We believe having that 7, 8 hours of sleep every night actually helps brain performance, not just in the immediacy of things,
Right.
but also in the long term.
Right.
So think about a healthy brain now and also in the future with a good solid 8 hours of sleep.
That's right. So you mentioned things like sleep apnea and insomnia, and people that are watching might be curious about how they can maybe identify, some symptoms or characteristics, because a lot of people don't know they might be having sleep issues and they just kind of, again, either brush it off or don't really think about it. So for someone that's watching us today and is like kind of listening to what you've said, that are like, maybe I have sleep apnea or maybe I have insomnia, what are some things that they should kind of look at during their sleep or throughout their day that might indicate that they have those things?
Good question. A good indicator of any of those things is just how you feel the next day, of course.
Right.
And people do come in and say, I just have insomnia, doc. Well, tell me why you think that. Well, I just wake up tired. Well, how many hours do you think you get? Well, I sleep 7, 8 hours, but I must have insomnia. Well, that still could be, but let's go into the quality of your sleep. What's going on that night? We wake up tired for many reasons, and it could be just an isolated bad night. But if that's a consistent issue, I wake up tired, I'm sleeping the day, I have a hard time focusing at work, I'm just not able to multitask like I used to. And I'm a little threatened behind the wheel, as well as other people could be threatened as a consequence. So, stopped at a traffic light and they just want to nod off, for example, potentially dangerous, as you'd assume. And so, snoring at night could be a symptom of sleep apnea. So if your bed partner's telling you snore, gasp, wake up feeling like there's something closing up on your throat, that's a pretty good indication that you might have sleep apnea. Of course, your bed partner is also a very good witness to apneas where we stop breathing, and of course, loud disruptive snoring. Those are good indicators that you might have sleep apnea. Worthwhile checking out. And checking that out could be a quick exam with your provider. They can look down your throat, look for airway obstruction. It's not always related to weight, by the way. People feel like, oh, I don't even want to look because, well, I'm not even heavy, and I don't fit the type, right? The stereotype of sleep.
Mhm.
We get your youngest, your thinnest people that can have sleep apnea. So again, that stereotype associated with overweight people, it doesn't always apply.
Right.
But saying that, it is associated with weight gain. And so someone might tell you, well, you are snoring more lately, honey, and you've gained a few pounds. So there could be a correlation there that you are developing or have
Mhm.
developed sleep apnea. It needs to be
Right.
checked out. And of course, so those are going to be the common symptoms with sleep apnea: snore, stop breathing, I'm tired in the day, I wake up non-restorative sleep. So get it checked out. And by the way, there's all sorts of tests that can be done. It's a home sleep apnea test. It could be in the sleep lab if necessary, but there's a lot of home testing devices that certainly make it convenient, practical for people to get assessed. Just an overnight or two that can tell them if you have sleep apnea or not, and then proceeding with treatment, which we have many treatments for sleep apnea, not just a standard CPAP, which
Mhm.
also intimidates people, but
Right.
other interventions that may be helpful. And again, seeing your provider, making sure what that treatment, a particular treatment, is appropriate for you, very, very helpful.
Right. That's awesome. Yeah, Ogden Clinic does have a bunch of great treatments and procedures that you guys do here as well. Do you want to talk a little bit
Well,
more about
sure. Yeah.
some popular ones that people kind of tend to come in for?
Well, popular. I guess numerically, yeah, CPAP is one of the more common treatments. Probably not popular from personal
Right.
experience for some intimidated people, but we see a lot of great benefit with CPAP. It normalizes breathing, it brings up your oxygen. The brain needs all that. It's good for the heart. And so, but wearing a mask can be intimidating. We go through a program of what we call CPAP desensitization, methods and means to help people get tolerant of their CPAP. Technology has really improved with CPAP.
Right.
We find better fitting masks, and we have machines that make things much more comfortable for people. And it is getting popular, at least numerically, in the sense that, you can talk to, there's someone, that's on CPAP.
Right.
Now, it could be a positive experience and maybe not so positive. But what we find overall, at least with our patients, about 80% of them do very well with CPAP. And maybe it takes a little bit of training, a little desensitization or TLC, but eventually we find a system that works for them for most of the time. Now, in terms of alternative therapies for sleep apnea, of course, there's dental appliances, and these are then should be customizable devices fitted by a dentist that's qualified for sleep apnea management. And so we can go that direction if appropriate, based on sleep testing, based on their anatomy, if they're candidates for some type of dental appliance, something that just goes in your mouth when you go to sleep at night, take it out in the morning. Can be quite helpful if appropriate. Surgical options, and now the old surgical option, including palate or surgical removal of the soft palate and uvula, may be appropriate, but we've advanced with surgical procedures as well, including a device that stimulates the hypoglossal nerve. It goes to the base of the tongue. This is an implanted device, and often done by ear, nose, and throat surgery. And then with follow through, we can identify the appropriate level of treatment over time. And that's also a very helpful type of intervention, especially for those that just can't deal with CPAP, or CPAP is insufficient treatment. So we can consider, it's called hypoglossal stimulation therapy, or the only brand out there is called Inspire right now. So we help with that process.
Awesome. Yeah, those are all great recommendations, but we'll leave more information about everything he talked about in regards to these procedures down in the comments below after this live. I do have a couple other questions that I want to kind of ask you. What about things like melatonin? Like, people tend to take a lot of those things to help them with their sleep. Is that a good practice to have, like, when you're trying to improve your sleep health? Or what is your opinion on things like melatonin?
Well, in general, in regards to either supplements or pharmaceutical medications, FDA approved for sleep insomnia, I think they have a role. I'm not a big fan of getting into the habit of things, and I think for bioindication for most of the sleep aids, even those that are prescribed and even those that have controlled substance scheduled for controlled substances, I think they can be appropriate for those that need kind of temporary help.
Right.
Get into a situation, a case of insomnia, they may be appropriate. I commonly prescribe those for those that travel, so we're dealing with jet lag or circadian problems, or perhaps those that are going through situational, stressful elements. So I see those sleep aids as good help for temporary use. And so we hope it is temporary, not get into a habit. And that is the risk of a lot of these prescribed sleep aids, is encouraging this habitual use.
Right.
And more often it's psychological dependency is the risk with these sleep aids. So we try to be careful with those, maybe appropriate. Over the counter, such as melatonin, if it helps great. I'm not terribly concerned about long-term implications of melatonin. I think if a person has been dealing with insomnia, that seems to be a chronic issue, but they get the assistance of over-the-counter melatonin, I'm completely fine with that. At reasonable doses. We don't want to go crazy because a lot of things are available over the counter. Now, some of the other sleep aids we often find, for example, PMs, Tylenol PM, ibuprofen, all of those that have essentially diphenhydramine. It's like a Benadryl type of antihistamine sedation, which all of us can be tired with the good old Benadryl, right? Diphenhydramine. But they can help, but many of us wake up kind of groggy, tired as a consequence. So they have their implications there. In addition to, as we get older, antihistamine effects on the brain, it can slow down cognition, and so we have to be a little careful. So even with the over-counter remedies, they have potential problems, and it may have to be selective in terms of what's appropriate or not. So you may want to talk to your doctor about some of those things. I don't think too many providers would have a problem with melatonin. I would just be careful with the maximum dosage and not take too much. Otherwise, there's people with kidney diseases. We have to be careful with what we consume over the counter. But otherwise, it's a relatively safe medicine as over the counter goes. But again, used appropriately.
Right. That's a good point. Yeah, because a lot of people do take things like that to kind of help them better to sleep. But if you feel like you're experiencing any other symptoms, that he has mentioned today about sleep apnea or insomnia, definitely make sure you talk to your provider, because would things like melatonin or these over the counters like help just in the short term and not necessarily in the long term, correct?
Well, again, my general reasoning applied, and general advisement is, yeah, I think these sleep aids should be just of temporary
Temporary,
use.
right?
Yeah. Again, physiologically, there may be some benefit helping sleep. But I think over time, what happens with almost any sleep aid is kind of more of a psychological
Hmm.
dependency. That means, oh, I got to take a pill to go to sleep now. And I'm
Right.
not going to sleep if I don't
If I
take
don't
this
take it,
magic pill that's
right?
just going to knock me out and give me a good night's sleep. With some of these over the counters, relatively harmless, but we still have to exercise caution. I think treating the underlying problem
Hmm.
is most beneficial. And then what is it? What is it that's keeping us from sleeping well? Is it just simple stress that can be managed appropriately? Or is there something going on that we need to identify and correct? Yeah, maybe some bad habits at night we could do better with. So identifying, oh, maybe I shouldn't be watching TV until midnight in bed
Right.
and with my phone in hand and my tablet in my
Right.
lap, and there's
I
the
just
TV
everything turned
going.
on.
And yeah, we can probably correct some of
Right.
those bad habits. Sometimes our nighttime eating can be problematic, especially spicy foods right at bedtime, and it
Yep.
keeps the bowels active. So we got to be mindful of that. And we like fluids, but we probably don't want to drink a whole lot right before bed. That makes us use the bathroom several times a night.
Hmm.
So we have to be mindful of that. Maybe even medications that encourage that too. So talk to your doctor. Is there something you can do?
Right.
Nighttime medications that make you use the bathroom less at night, for example. But largely, what we do is we take our problems to bed, and we ruminate over and over again some of those issues or anxieties about the next day, what we did that day. And so, again, journaling can be quite helpful for that. But if you get into that mindset, you just can't let go of these things. Well, what we call stimulation control can be quite helpful, and that is you get out of bed. After
Hmm.
my rule is a 15-minute rule. If you're not asleep in 15 minutes, well, get out of bed. Do something boring, though. You don't want to do anything stimulating, looking at more screens and so forth.
Hmm.
I think a little book lamp is fine.
Hmm.
And read a boring book, right?
Right.
Nothing emotionally stimulating, though. You want to up all night with a
Yeah,
very
you don't want
interesting
something that's going
book.
to keep you engaged.
So, something that's a little distracting. You can let those other ruminating thoughts go, and
Right.
just get lost in the book. Allow yourself to calm down mentally. Hopefully, you can go to sleep within a few minutes. Then you get back into bed. But again, if you're not asleep in 15 minutes, you just get out and do something boring. Low lights, low activity, something boring.
Right. Yeah, that's a great tip. I don't think I've ever thought about that. I mean, there's definitely been times where I just kind of lay in bed and force myself to fall asleep, but that's a good little tip. Get out of
Yeah,
bed, do something boring.
forcing is a bad idea. You don't want to force anything when it comes to sleep because it should be just natural.
Right.
So if you think, oh, I got to go to sleep now, I got a busy, oh, that's just going
It
to
just makes it
perpetuate
worse. Yeah.
it is.
Yeah,
So
and from experience that is definitely true where you just lay there and you're just like, "Oh man, I can't fall asleep," and you're trying so hard and
mhm.
it just makes it an even worse experience than what it already started as.
Well, absolutely. So just allow those natural tendencies. Yeah, you kind of have to get yourself in that mindset because what you don't want to do is not sleep in bed. What happens over time is that, as we identify, kind of perpetuates the problem, but then it makes things very aggravating. Oh,
Mhm.
and so what happens? We get into bed, oh, another night I have to deal with. Oh, this is just going to be torture. I'm going to be up for hours again. And so you can see that the cycle,
Right.
perpetual motion taking place here where we're not sleeping, and what we do is we develop a negative association. The bed no longer equals sleep like it
Mhm.
should,
Mhm.
and becomes almost a place of torture for some people.
Right.
So, how do we reverse that? Yeah, retraining the brain that the bed equals sleep only. And so we only want to sleep in bed. So, why we apply this 15-minute rule. And even for now, we don't go to bed until we feel like we can go to sleep. Once in bed, we're not sleeping after 15 minutes. We get up, we do something boring. So the only things we should be doing in bed is sleep. So building a positive association is crucial.
Mhm.
Retraining the brain, get that better attitude with your bed. That is the
Right.
place for sleep, sleep only, nothing else.
Right. Right. Yeah, that's a great tip. So journaling, making sure the bed equals a positive sleeping environment for you are all really helpful things to do
Mhm.
during the holidays. Like I said, it really spikes up your anxiety and your stress. So we want to make sure we're still engaging in healthy habits and doing all that.
Yeah, well, stress management applies. So what can also help insomnia is good physical activity. So as busy as the holidays get, you got to make time to exercise. If you're not on the routine already, by all means, get into
Hmm.
one. Ask for that bike, ask for a treadmill, something that might help encourage a routine activity sooner. But incorporate that even now, even if it's simple floor work, if it's yoga, Pilates, what have you. Do your calisthenics, do what helps to get a little bit of cardiovascular activity. And the general recommendations, you don't want to do that 2 or 3 hours before bed, certainly. But I think a good regular exercise habit at some time earlier in the day is going to help you sleep better at
Hmm.
night. So as tough as it is in the holidays, I think it's important to incorporate.
Stuff like that. Yeah, that's awesome. Well, those were all amazing tips. Is there any other final tip that you can think of that people can jot down aside from everything you've talked about today?
Well, sleep hygiene applied, and so taking warm baths before bed, putting away the busy stuff. I think encouraging the kids to do the same,
Right.
because especially in the holidays, I think the whole family's a little wired and excited for
Hmm.
things. So get into that habit at least 1 hour before bed. That things are just calming down. So get in the warm bath, turn the lights down, turn off all the electronics, make it a good family habit of things too as we're moving forward into the holidays with all the hustle and bustle.
Right.
I think can get us through that. But make it good, make it a good spirit adventure for the family nonetheless. But practicing those good sleep hygiene principles can get us through in a more healthy minded way. And we better sleep means just a better day, right?
Right. Exactly. We all want to get good sleep. We all want to have a good day, especially during this time of the year. So, those were all amazing tips. I will leave Dr. Hammond's information down in the comments below if you want to learn more about him and what he does and how you could schedule an appointment. If you watch this today and you're like, maybe I have insomnia or maybe I have sleep apnea and want to learn more about what I can do, I will leave his information in the comments. But if there are any questions from our viewers, feel free to leave them down below. Dr. Hammond will be happy to answer them for you to the best of his knowledge. And obviously, he's very knowledgeable about sleep. But anything else you'd like to
No,
add
thank
before
you.
we hop
No,
off?
everybody have a happy Christmas, New Year. Be safe out there. Get some good sleep. All right.
All righty. Well, thank you so much, Dr. Hammond. It
Thank
was great
you.
having
Oh,
you.
it's been terrific. Thank
Thank
you.
you.